Welcome everyone to this important press conference. My name is Ron Obear. I'm the interim dean of the Brown University School of Public Health. We are honored to host this event and very thankful for all the tremendous work Senator Reed does for the state of Rhode Island and Congress. I want to take this opportunity to acknowledge Attorney General Nerona and Chief Wardell. Thank you for all that you are doing to address the opioid epidemic in Rhode Island. And also, thank you so much for spending some time with us to find out what some of the researchers and research that's being conducted here at the Brown University School of Public Health. And with that, I will turn it over to our guest, Senator Jack Reed.
Thank you, Dean. Thank you very much. Well, thank you very much, Dean. It is a privilege and a pleasure to be here today, and we are really blessed with an incredible group of people. Let me recognize formally Dean Obear, thank you. Dr. Baldwin, thank you. Attorney General Nerona, Chief Wardell, thank you. And Dr. Rainey, thank you very much. I'm here today to first thank you all, not just you individually, but the men and women who are on the front lines as police officers, the healthcare professionals, everyone, and the researchers at Brown and around this state that are doing so much. So thank you very, very much. I also came to learn, and I did already. We had a fascinating discussion about some of the recent implications that have been discovered by Brown and others. And then we've all got to raise public awareness about a new devastating drug that's been discovered by Brown researchers. And so we want to get that word out. And then I want to just let you know what we're doing in Washington to provide new tools, new resources to combat this crisis that faces us. We can be very proud of Rhode Island. We have been a leader on tackling the synthetic opioid crisis from every angle. The Attorney General has done an outstanding job with his leadership. It's been central to this effort. His office is going after the most responsible individuals for this drug crisis, putting them away and winning important court cases. Thank you, General, for your great work. Rhode Island's harm reduction community is a broad coalition of academics, community workers, it's Brown, it's Kodak. They deserve our gratitude and recognition too. And of course, the researchers here at Brown, the School of Public Health, has been amazing of what they're doing to inform us, the policymakers, about what is the problem and what are the best possible solutions. So thank you again. And last but certainly not least, our police departments. Chief, thanks so much. Convey that to your colleagues, all of them. They're doing every day a job that is saving lives and protecting the community. Not only picking up the bad guys, but actually treating victims of overdose right there on the street. And it's remarkable, and they deserve our thanks. Shortly, I'm going to ask the Attorney General and Chief Wardell and this amazing Brown team to get up and speak, but one thing I want to do is to, again, reinforce this notion of a new threat. And that new threat is xylazine. It is an animal tranquilizer that is called tranq. That's the shorthand for it. And Brown researchers found out that this drug is showing up in more than 40% of illicit street deals in Rhode Island. So we were worried about fentanyl, we were worried about this, now we have tranq to confront. The good news is the Brown team is on it. They're researching it, they're trying to find out the ramifications of its use, they're trying to find ways to deal with it and treat it. So we're in the game, and that's extraordinarily important. But it does seem to be increasingly prevalent in overdose deaths, and the team is trying to figure out what is the combination of fentanyl, heroin, tranq, etc. And that is important work. We thank you. The FDA has warned the whole country that this drug is now on the streets. And since it's not an opioid, xylazine may not respond to naloxone. My pronunciation, that's why I'm a politician, not a doctor, is terrible. And it's a potential problem, obviously. And may be a deadly problem. Now, the federal government, by the way, has not listed xylazine as a controlled substance for humans or animals, which means drug enforcement personnel have been monitoring it for abuse, but can't take decisive action if that's the only chemical involved. And we have to look closely at that. This very well should be on the controlled substance list, but that's something we have to do. Now, as I said, I wanted to give you some idea of what we're doing at the federal level to help respond to this crisis. And I'm chairman of the Senate Armed Services Committee. And one of the things that happens every year so far, we pass an armed services authorization bill. But on that bill, that's the engine, it pulls a lot of other important issues. And these are some of the things we're able to do with regard to this crisis through the Armed Services bill. We passed the Fentanyl Results Act, which is going to direct the U.S. Department of State to build greater foreign law enforcement capacity to detect synthetic drugs, and also carry out international exchange programs for drug demand reduction experts so we can start collaborating. And I was talking to the doctors and the dean beforehand, and the general and the chief, and I can recall in the late 90s going to Austria and seeing a clinic that was dispensing in a controlled and very carefully controlled way heroin. Other countries have different techniques that we can use, and this is going to help stimulate that interchange. We've also passed the Protecting American Borders Against Fentanyl Act, which requires the U.S. Department of Homeland Security to work with other agencies to research additional technologies to target and detect illicit fentanyl, including the chemicals used to make it, and it requires the Office of National Drug Control Policy to develop strategies to evaluate regional specific interdiction goals. So we can look at the Canadian border, we can look at the southern border, and we can come up with tools that will help us stop the flow of fentanyl. And we've also passed the Prevent Act. It requires DHS to provide drug containment devices to our frontline Border Patrol agents so they can safely handle and store illicit fentanyl if they seize it on the border. Finally, and additionally, and importantly, the Omnibus Appropriations Bill signed by President Biden significantly boosts funding to the CDC. Overall, the law provides $4.9 billion to address opioid abuse. That's an increase of over $345 million. The funding includes nearly $1.6 billion to states to address the opioid epidemic through the State Opioid Response Grant Program. So we're putting our money where our speeches are. We really need to do that. Bottom line, illicit fentanyl and other synthetics are poisoning people and harming our communities. These new laws will help. These new resources will help. The combination of all of our drug treatment specialists, our researchers, our police, our attorney general, all of them will make a real difference. We will continue to be, at the federal level, a reliable partner in this very important effort to stem this crisis. And with that, let me introduce, it gives me great pleasure to introduce, and I repeat myself, our great Attorney General, Peter Nerone. Thank you, Peter.
Thank you, Senator, and thank you for your consistent leadership on behalf of Rhode Island in so many areas, including this one. You know, I've been a state or federal prosecutor now for a very, very long time, since the mid-1990s, and the more things change, frankly, the more they stay the same. And I haven't just been an Attorney General or United States Attorney. I've been an Assistant Attorney General, and I've been an Assistant United States Attorney, and so I have seen sort of this, you know, the course of the war on drugs, if you will, for now a very, very long time. So when I was a young prosecutor, we were really concerned about cocaine. I mean, we really did not have many heroin cases. I'm sure the School of Public Health knows this. We really did not have many heroin cases, really at all, when I was an Assistant Attorney General in the 90s and early 2000s. And then heroin came on the scene shortly after that, probably in the middle 2000s. And then, you know, sort of fentanyl just sort of arrived, and from my memory, really our first cases were in Barville. So we really started to see this heroin fentanyl problem really manifests itself in Barberville of all places. And so it didn't happen in our urban core, it happened in some of our more rural areas. And what became very clear afterwards was that this was a problem that was happening everywhere across our state, across the country, and impacting literally everybody. And I'm not saying anything here that most Rhode Islanders don't already know, and certainly the School of Public Health doesn't already know. And so it's been very clear to me for a long time that the way we address this problem is really twofold. One, we have to go after people that are dealing in this illicit substance, not users. It's not what I'm talking about. People who deal in these illicit substances. And that's not just drug dealers. Sometimes it's pharmaceutical companies, quite frankly. And so that has been multifaceted in that way. Even that going after dealers, if you will, has been multifaceted. But I've always believed that people who have substance use disorder should not be treated, should not become part, frankly, of our criminal justice system. They end up there oftentimes. That's where they end up. But our mission in the criminal justice system for someone who has a substance use disorder is to get them out of that system as quickly as possible with minimal consequences for people who are using drugs for personal use. So what's the answer for them? Well, the answer for them lies here and in the treatment community. And we have to provide the necessary resources for them to deliver the treatment for substance use disorder wherever we can. So let me just say that if that substance use disorder treatment needs to be in Woonsocket, as it clearly does, we need to do everything we can to make sure it's available in Woonsocket and everywhere around the state. It's why we work so hard to bring $250 million in life-saving medicine and resources for treatment back to Rhode Island. We need to make sure now that the money is here and is coming over the next decade or so that it gets to where it needs to go. And so I'll end where I started. I want to come back to Senator Reed. Senator Reed has done so much. You've done so much, Senator, to make sure that the state has the necessary resources to take on these challenges, and I know that you'll continue to do that. And so on behalf of my office, and on my behalf, I really offer you my thanks. And so with that, I will depart and introduce my friend, thank you, Senator, for the handoff, introduce my friend and colleague, Sid Wardell, who leads the Rhode Island Police Chiefs Association. And I will tell you that, I have worked with a lot of chiefs over the years, and I have enjoyed those relationships very much. But the Rhode Island Police Chiefs today really get it. They understand the difference between a drug dealer and someone with substance use disorder. And Senator Reed is absolutely right that, I have traveled enough with police chiefs, including this one when he still was the chief in Little Compton, to see that police officers are interacting with people with substance use disorder every single day. I mean, you can walk through the streets of Providence and just see it. And those police officers react to people with substance use disorder in times of crisis, not only to deliver life-saving medicine through the use of Narcan, but also getting them to treatment. Their focus today is not about arrest. It is about, through the HOPE initiative, getting them into treatment. And so with that, I turn it over to my friend and colleague, Chief Wardell of the Police Chiefs Association.
Thank you, General. It's always good to be amongst friends, and I always wonder if the General's going to go down the road of the story where when he came out to sort of do a check-in with each of the police departments and the chiefs to see how things are going. And I said, sure, but you got to go with me because we're doing a surveillance. We've got folks that are breaking into houses, and I'm one of 3 people on the road today in Little Compton, so you're going to have to ride with me. So luckily, he didn't know that the line between Massachusetts and Rhode Island was so close, so we traveled over that pretty easily. But no, thank you, General. Thanks for those kind words. So good morning. My name is Sid Wardell. I am the Executive Director of the Rhode Island Police Chiefs Association. I bring the greetings from our newly installed President, Kevin Lynch, who is the Chief of Police of the Bristol Police Department. And I want to start also by thanking the Senator for all of the work that he has done in recognizing what law enforcement does, not just here, but across the country. And I was actually at an event with the Senator where he made a comment that just rung so deep with me on his understanding with law enforcement, and he said, unfortunately, because of some circumstances, he's gotten a deeper appreciation of what law enforcement does because of working so closely with the U.S. Capitol Police. And that's not to say that I had any doubt that he knew what law enforcement was out there doing, but enough for him to recognize that that was a point, at least for him, to recognize that piece of what law enforcement does across the country. And we're here actually to build on the blocks of so many things that the senator has done in the past as well. His leadership and forethought in programs that have been piloted here in Rhode Island to help address our opioid epidemic. But unfortunately, today's focus is on a conversation that we have to recognize that the increasing population that has a substance abuse illness, that's killing them. More often than not, though, it's not about what they're taking, it's about the hidden killer that's within that substance. And the great work that Brown University is doing here to help us, the first responders, both be educated, but also to understand this. Not to date myself, but to go back, as the general said, in the late 80s, early 90s of heroin, and most recently now with officers carrying Narcan. It's a very chilling effect to an officer on the road now that one dose of Narcan doesn't do it. And that brings in all this questioning on, are you going down the right road? Do you still believe that this is in fact an overdose? And we had no idea. We thought it was probably because of more fentanyl in there, whatever the dosages were, but now we're looking at because of all of these other synthetic drugs and things that are a part of that. So for an officer on the road that's out there and doing what some would say they didn't sign up to do, but I think all have embraced as the right thing to do, and now the naloxone, the Narcan that you're carrying on your side is no longer good enough. And you're looking for 3 or 4 or 5 other dosages to be able to give an individual. We heard the name, as the senator said, coming in with the name, but on the road here it's being called tranq, or even the words of zombie drug. Luckily in Rhode Island we have a statewide overdose alert system, and with random drug testing that's being done, we've unfortunately recognized that we're not immune to the same things that are going on across the country. Over the last few years, Senator Reed has helped us to obtain federal funds through many other initiatives, like the HOPE initiative that the General talked about. Many of the community outreach programs would complement the work of the Governor's Prevention and Intervention Task Force and law enforcement's efforts. The most recent funding announced by the Senator will help us to build on those efforts. And at the end of the day, without these types of additional funds, we're unable to work with practitioners and researchers like Brown University School of Public Health to help us educate our first responders and community stakeholders to help find manageable solutions to assist our sick, but also their families. And that's the piece with law enforcement, that being the first responders that are out there, that oftentimes comes into the feeling of not being able to do enough, is those other wraparound services. So by having funding and availability of a lot of those outreach programs that we're doing in Rhode Island, because of past money and now the continuation of other funding, those services will be able to enhance in doing them. Is that my timer? I apologize. Lastly, I'd like to applaud portions of this federal funding that is often overlooked, though, Senator. That being funds for programs which help keep our first responders safe. We tend to focus on what is directly in front of us and lose sight of the big picture, which includes our Border Patrol agents and the men and women that are truly on the front lines of the opioid epidemic. Funding for protecting America's borders against Fentanyl Act and the Prevention Exposure to Narcotics and Toxins Act certainly will strengthen those efforts. So on behalf of the organization, sir, on behalf of law enforcement in Rhode Island, thank you.
Thank you.
Thank you, sir.
Now, Dr. Rainey and this tremendous Brown team. Please, Doctor.
Thank you. Thank you, Senator. Thank you, and I just want to add on to Dean Obear's warm welcome to everyone to our School of Public Health here at Brown. I want to thank Senator Reed, General Nerona, Chief Wardell. I'm honored to stand with you here today and truly honored to welcome you to the Brown School of Public Health. Thank you for your joint leadership on these important issues, and Senator Reed, thank you for making it possible for us all to be here today to talk about this issue that's affecting Rhode Island but also affecting the rest of the country. Here at Brown, we share your commitment and determination to confront the growing epidemic of fentanyl overdoses and opioid use disorder. I'll say, as many of you know, I'm both an emergency physician and a public health leader, and in both roles, I see firsthand the impact of this epidemic, not only on individuals, but on families and on communities. Too many lives are being lost or forever changed, and too many are at risk from dangers they cannot see. With increasing availability of powerful synthetic opioids, overdoses have become both more frequent and more fatal. As others have noted today, deaths from fentanyl are rising dramatically, and this new drug, xylazine, provides a lethal pairing that we're only just starting to plumb the depths of. The challenge is both clear and urgent. Now, here at the Brown School of Public Health, our faculty and researchers across all of our departments are making a difference and forging new paths with innovative thinking and new approaches to the problem. Through TestRI, we're testing drug supplies and providing supplies to folks on the street to help them test, to identify what's actually in the substances that people are using. We're listening to people who are affected by substance use disorder to understand how their practices have changed with the supply and how best to share what we are learning to help reduce risk, overdoses, and death. First results from TestRI, as has been mentioned, shows that 44% of samples here in Rhode Island do contain xylazine, and many contain high levels of fentanyl and other synthetic opioids, which again, the dosage required to cause an overdose with those synthetic opioids is an order of magnitude lower. So just a little bit, if you ingest it, not if you touch it, but if you ingest it, can cause an overdose. I'll also highlight that our school and the researchers and leaders within it are national leaders in harm reduction and increasing treatment access. And I cannot say this strongly enough that it is about that increased access to non-stigmatizing treatment that is the key to reducing overdose and promoting recovery for people affected by this disease. As you highlighted, Attorney General, it is not about criminalizing the folks that are affected by substance use disorder. It is providing pathways to treatment and to getting folks kind of out of the cycle of use and overdose. We're also at the forefront of work around overdose prevention centers and are among the first sites in the United States to have state approval for this important work. I just can't overstate how important and influential this is. The goal of these overdose reduction prevention centers is to protect people who use opioids and other controlled substances from overdose by, as you mentioned, Senator Reed, providing a safe place to consume those drugs with access also to counseling and other services such as medication-assisted treatment should they wish to kind of change course and to use MAT. Our faculty and our researchers have studied these centers in other countries, and so that opportunity to expand that collaboration is terrific. And they're now leading the work to both to evaluate them here in our country and in our state to see how they work, how to make them most available, how to reduce stigma, and improve long-term outcomes. Senator Reed's new bills, and most of all his support of the Omnibus Act and the increased CDC funding, make those critical funds available to help support people and communities affected by this opioid use epidemic. Thank you, Senator Reed, for your leadership. So for all the progress we're making, of course, there are ever more challenges. Just like with COVID, new things evolve, and we're seeing basically new variants of drugs, more dangerous drugs, and unfortunately more deaths, and more people who can't get the prevention and treatment they need. So I welcome you all here today as a day of recommitting to doing all we can to meet these challenges. At the Brown School of Public Health, we are steadfast in this work, and we deeply appreciate all three of your partnership in it. So thank you.
Well, thank you very much. If there are any questions, my lawyer will handle the difficult ones. Attorney General Dorona. If there are no questions, then keep up the good work, please. It's important. Thank you very, very much.